health using natural remedies. So I'm currently live streaming both on YouTube and TikTok, so welcome to both my communities on both of these channels. Thanks everybody for joining. Welcome to the Let's Talk Health live stream. Feel free to drop any questions that you might have in the comments, and I will answer them for you. So some typical questions that we get are generally about general health concerns. Maybe you have gut health concerns, maybe you have hormonal concerns, or you're just interested in a type of supplement, or you want me to talk about certain popular health topics right now. So feel free to ask me any questions, I will answer them for you. All right, so we will just wait to see if anybody asks any questions, but welcome if anybody's just joining in. Welcome, I'm Dr. Amanda, I'm a naturopathic doctor. This is Let's Talk Health live stream. I'm going live on both YouTube and TikTok, so I will be going between both of those channels to answer any questions that might come in. If you're new here and you've never joined this live stream before, welcome. I'm here to answer any health questions that you might have. You can ask a variety of different health questions, and I will do my best to answer them as best as I can. Just a note that this channel and this live stream, it's not medical advice, so just keep that in mind whenever you're asking me something. I don't know your medical history, but I will do my best to give you some health tips, and then you can always double check everything with your provider as well. All right, so welcome. If anybody's just joining, welcome to the Let's Talk Health live stream. Feel free to drop any health questions in the comments. Maybe let me know if there's a certain supplement that you're taking, if you have any questions about that. You can also just drop where you're from in the comments. That way I can know where my followers are from and helps us interact with each other. I'm currently streaming live from California. I'm streaming live on both TikTok and YouTube, so I will be going through both of those channels. All right, if anybody's watching and you just jumped on, welcome. This is the Let's Talk Health live stream. I'm Dr. Amanda. If you want your health questions answered, feel free to drop them in the comments. Make sure you double tap to like this video so that way I know you are enjoying the live stream and you receive some help. Feel free to ask me anything that you wanted to know, whether that be diet, lifestyle, nutrition related, supplements. If you have a certain health condition that you wanted some more questions or some more information about. We can also talk about lab testing. A lot of people are really curious in different types of tests. So whether that be a gut health test, like a stool test, if you have questions about that. If you were curious about like what kind of blood work you should run for certain conditions, we can talk about all of that as well. All right, so if you've just joined us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda Morelli, naturopathic doctor. This live stream is focusing more on natural remedies. That could be things like herbs, and supplements, and vitamins, anything that you might want to know about your health and how you can help improve your health. So we'll just see if there's any questions that anybody might have. All right.
What do you recommend eating before going to sleep?
That's a good question. So the question was, what do you recommend eating before you go to sleep? So generally, you don't want to eat too close to your bedtime. If you're eating too close to your bedtime, that can cause things like acid reflux. It can then cause you to have a difficulty sleeping just because your body's working on digestion and it's not able to really relax. So what I would recommend is giving yourself about 2 hours to have your last meal or your snack before bed. And then that meal should be consist of like a balanced meal. And when I say balanced, that means you want some protein, you want some fats, and you want some good complex carbohydrates in there. So the question was, what should we eat before bed? So if we're looking at something that's balanced, so you want to have a protein source, could be something like meat, could be eggs, could be yogurt, could be a protein powder, and then you want to have some fats in there. That would be something like avocados or nuts or seeds, almond butter, and then some good fiber in there. So again, some good like nuts and seeds. So having something like Trail mix is a great option if you're looking more for a snack as opposed to dinner. Having some like nuts and seeds would be a great option there. The reason being is it's going to help to balance your blood sugar. So if you're going to have something that's like something like a dessert or something sweet, which most people probably would have like as their last snack, that's actually going to then spike your blood sugar before bed, which can cause difficulty with sleeping. It can cause insulin resistance, so you want to make sure that that last meal is balanced. It's a good question. So if anybody just joined, feel free to leave your health questions in the comments. So this is the Let's Talk Health live stream chat. I'm streaming both from YouTube and TikTok, so feel free to leave the questions in the comments and like this video so that way it gets across our channel and more people can see this and come online and ask me questions. All right, so we had a question about diet. Another question that I get often is like, what type of magnesium supplement is helpful for me? So let me know in the comments, are you taking a magnesium supplement? Did you just take one because you heard magnesium was good, but maybe you didn't know there's many different types of magnesium? So let's talk a little bit about the types of magnesium. So one popular type of magnesium is the glycinate or the glycinate magnesium. This one's really good for helping to calm the nervous system and calm down any stress or tension. So if you're somebody that gets really stressed out, if you feel like nervous, if you feel anxious, magnesium glycinate is a great option. So this one usually comes in a capsule form. Okay, so magnesium glycinate can come in a capsule form. Generally, the dose for this would be about 200, 400 milligrams. And usually this one's nice to take at the end of the day to kind of help calm the body down and help you sleep. The other option is magnesium malate. So if you're somebody that exercises, if you have a lot of muscle tension, if you even have like an injury, magnesium malate is really good for muscle health. So that's magnesium malate. Then there's magnesium citrate. That one is better if you're constipated. So if you suffer more from constipation, magnesium citrate is good because it kind of acts as a mild laxative. What it does is it helps to bring water into the intestines and help a more softer bowel movement. So that's a good one. What else is there? There's magnesium threonate. That one is good for the brain, for cognitive health. Really good for migraines. It helps to cross that blood-brain barrier. So those are 4 pretty popular magnesiums. I would say the most common ones. I wouldn't recommend magnesium oxide. There's not much benefit to it, and it can cause a lot of loose stools. So, all right, that was our little talk about magnesium. If anybody's just joined us, hi, welcome. I'm Dr. Amanda Morelli, naturopathic doctor. Welcome to the Let's Talk Health live stream. Feel free to drop any questions that you might have in the chat, whether that be about a certain health condition, a supplement, maybe you're curious about foods that can help XYZ, whatever it is, feel free to drop that in the comments and I will be able to answer that for you.
Fartoon says, I was taking magnesium G, but now I take magnesium citrate for BM and it also helps sleep.
Yeah, so the citrate can also help with sleep too. It is still, magnesium in general is still going to be a nice calming mineral. So yeah, so for constipation, that's right, the citrate one is the one that's beneficial too. Yeah, most people like to take magnesium in the evening because it is calming, but you could take it during the day. It still is beneficial. And then the other benefit of magnesium is it helps with vitamin D absorption and helps to improve your vitamin D levels, which are really important for your mood, for your hormone health, for your energy.
What do you do to stay consistent when eating healthy?
That's such a good question, and I think that's where most people struggle, is consistency. So usually what I recommend whenever you're starting a new diet or nutrition routine, you want to start slow. You don't want to overwhelm yourself with too many things. So a lot of times what I work on with patients is like, let's pick one meal a day, like let's say the meal that's the hardest for you, and let's make changes to that. Generally what I find is most people are pretty good with dinner. And I think that's just because like you have time at home, maybe you're with a family or you're on your own and you have that chance to make dinner, but a lot of times people struggle with breakfast and with lunch. So what I would say is focus on choosing one of those meals and choosing something where you can improve those meals, whether that be you have to get better at choosing healthier choices, you need to meal prep something so that way it's ready ahead of time, and then that will help you be a bit more consistent. But of course it's common and it's hard to be consistent with diet. All right, good questions, both of you. Thank you for your questions. Make sure to like this video if you found the answers helpful. If you have any further questions on what my answer was, feel free to drop that in the comments and I can answer if you need any more clarification. And if you're just joined us, welcome to Let's Talk Health live stream of Dr. Amanda Morelli. I'm here to answer any health questions you might have. My main focus is more on natural herbs, remedies, diet, supplements, so feel free to ask me questions about that.
Fortune asks, please, can you talk about inositol and insulin resistance? I am up around 12 a.m. to 4 a.m. to urinate.
Yeah, so insulin resistance and inositol, that's a great thing. Let's talk about that. So I'll just kind of talk a little bit about insulin resistance in case some people aren't familiar with what that means. So insulin is a hormone that your body produces, specifically your pancreas will produce insulin. And its role is to help balance out your blood sugar. So anytime you eat something, what happens is you're going to get a flood of glucose into your bloodstream. Now, depending on what you eat, like if you're eating something that's more protein and fat, you're not going to get as much glucose as opposed to something that's more carbohydrate heavy. But when your body senses the glucose in the bloodstream, what happens is it releases insulin, and insulin will come into the bloodstream and it will take those glucose molecules and bring them into your cells so you're not left with high blood sugar. Now, when you have something called insulin resistance, what needs to happen is your body is trying to work harder to balance the blood sugar. So it's putting out more and more insulin, your body's not really responding, and then it needs more insulin to balance the blood sugar. So that's just kind of what insulin resistance means in case anybody didn't know. Insulin resistance can happen like before diabetes can happen. It's kind of like even before pre-diabetes. So the question about inositol, that's one remedy that can help with insulin resistance. Specifically, it's helpful for a condition called polycystic ovarian syndrome. That's where it's really been studied, and because there's insulin resistance in that condition. And the way it works is it helps with your body balancing out that insulin, balancing out your blood sugar to help with more blood sugar control. Now, something like inositol, you would take this with food. So whether that be breakfast, lunch, or dinner, generally twice a day is pretty good. A general dose for inositol is about 4 grams. So you could split that up in like 2 in the morning and 2 at night. Mix it in water because it comes in a powder, and then take it with a meal to help with offsetting that glucose spike. Another question or another comment about insulin resistance, berberine is a really good supplement for that. Works similar to inositol, similar to medications that help with blood sugar control. So berberine can also be taken with meals to help offset that glucose spike. So that was a great question. So just to recap, we talked about insulin resistance and how inositol and berberine can help with balancing out blood sugar and reducing insulin resistance. If there's anybody else that has questions about insulin resistance, feel free to ask me. And if you found the answer helpful and you found this live stream helpful, make sure to like the video, double tap. It does help get my video and channel noticed across the live stream. So,
What helps with fibromyalgia?
that's a good question. So again, fibromyalgia, in case nobody knows, that's where you pretty much experience fatigue, body aches, pain. There isn't really a root or known cause. It's kind of a diagnosis of excluding other things. So making sure, there's no underlying autoimmune concerns going on that's contributing to this. So I would say fibromyalgia is like a multi-step approach. If we're talking about things like supplements, mitochondria support is helpful for this. So mitochondria produces energy in your body. So that would be looking at things like CoQ10, alpha lipoic acid. Those are two ingredients that can help out with supporting mitochondria. Even something as simple as a B complex. So B complex is a supplement that has a bunch of your B vitamins in it, and B vitamins are important for so much in the body. They do give you energy, so looking into B complex. And then one thing that's really helpful, like a tip with fibromyalgia, is giving yourself time and pacing yourself. A lot of times we tend to overdo things, or we don't realize like how much we've done until it's kind of too late. So really pacing yourself with fibromyalgia. Maybe that means you can only do like one task a day, whether that be cleaning up your kitchen or going grocery shopping or walking your dog. It'd be way too much to do everything at once. So that's just a tip with fibromyalgia. Really pace yourself, know your limits, give yourself some time to rest. And then also just some other tips for fibro. You want to make sure you get blood work done. So what's your vitamin D levels like? What's your B12? What's your blood sugar like? Iron. All of these are pretty important to know when you have fibromyalgia. So if you have any follow-up question to that, let me know. If that was helpful, make sure you like this video, double tap, or you can like it on YouTube. I am streaming both on YouTube and TikTok, so if you're watching on YouTube, go follow me on TikTok, and then if you're watching on TikTok, go ahead and join my YouTube community there. I post about both. I post on both channels, focusing on different health topics, health concerns. All right. Okay, so if anybody just joined, welcome. I'm Dr. Amanda Morelli. This is our Let's Talk Health live stream. I'm streaming both on YouTube and TikTok, so feel free to drop any questions in the chat. I will hang around for a few more minutes just to answer any questions that you might have. And thanks everybody for joining. Thanks for all the likes so far. Yeah, so far we've talked a little bit about magnesium and some diet and insulin resistance questions. And if you have any follow-up questions, feel free to answer, or feel free to ask those and I will answer them. All right.